You're welcome back. This is NewsFile, it's the most authoritative news analysis platform. I'm your host, Samson Ladi Anyanini, and my guest this morning already in the studio is Kojo Opong Nkrumah, the MP for Ofuase Ayirebi and Minister for Information. He will be joined later by John Abdullahi Jinapo, MP Yape Kusogu, Dr. Priscilla Chumesi Bafo, Senior Lecturer, Department of Economics, University of Ghana, and Professor Godfred Bokwing, Professor of Finance, University of Ghana. But this moment, could you welcome to the show?
Thank you for having me, Samson.
Great. This moment, we have Dr. Patrick Abuaje, who is Director General, Ghana Health Service, and Dr. Kwame Sapong-Asiedu, who is pharmacist and fellow, Ghana Center for Democratic Development. Thank you, gentlemen, for joining us via Zoom.
Thank you, Samson, for having us. And thank you, Patrick. Good morning.
Right. Okay, so Dr. Abuaje, we should start with you. And I think that Ghana is indebted to people like you for your commitment so far in helping this nation, go through this crisis. And thankfully, Ghana is celebrated among the nations that got things right about COVID-19 so far. So the vaccination, how far have you gone with it? Satisfactory?
Yeah, thank you very much. I think it's probably better than we anticipated. And because of initial talk about hesitancy among others, I think now we are having to deal with how do we cope with the pressure. We have so far done about 387,000 people have been vaccinated. But that is what we have on the electronic platform. We have about 50,000 data to be keyed in. And so we are looking at about, I would say about 430,000 people have so far been vaccinated across the country. That is the 43 district that we are currently focusing on, which is Greater Accra, Ashanti region, and 2 districts in Central region. So that's where we are in terms of the total numbers of people who have been vaccinated.
Right, and that will mean that you have some 170,000 vaccines or doses left?
Normally, we will have about 5% wastage. And so, for example, if you open a 10-vial bottle and you're able to use 9, and it's 6 hours later, you have to keep it overnight. You can't use it again because once you open the vaccine, within 6 hours, no use. So we have a margin of 5%. So we had about 580,000 earmarked for vaccination. That's what we are heading for.
Right.
Towards now.
Right. So this must be very satisfactory in your estimation, not so?
Yes. I think we are quite happy with the enthusiasm and the faith that the people have. But I believe that the initial phase of the president and others, key influentials, taking it also show people that it's actually safe. Of course, apart from looking globally that the whole world is getting vaccinated and you are not seeing any severe adverse effects. I think that is all part of that. And of course, the work of the information and our risk communication team that encourage people about the safety and all the information that they need. I think that has greatly helped.
You're right. Within such a short time, and to be able to get this number in the midst of the myths that are being peddled around, and I'm surprised to meet people who are supposed to know, who still can't, agree that there's nothing wrong with it and that it is safe. I took my jab on Tuesday, and there were a few things I was made to expect, and I've been okay. I had just a little bit of some small pain and headache, and within less than 42 hours, I'm okay. What do you say about those who are beginning to get a bit scared because of the reactions that they get? That a lot of people are talking about it, and it's feeding into the fears that some may have.
Well, thank you very much. The last time we checked, we've had recorded about 707 adverse events, and these are all minor, expected minor events: headaches, fever, body aches, of course, pain at the site of injection. And for vaccination, what you are putting something in your body so that the body responds, and in anticipation of when the real virus coming, that response should elicit some mild effects. Some of them are so mild they don't feel it. Others may feel it. And so the actual part of our communication, and even at the time of vaccination, some of this information is given. And Ghana is known to be giving one of the best when it comes to vaccination. About 94% of all our children are vaccinated at least the first 1 year. And they have fever, we are giving paracetamol to take, and mothers and fathers are very happy to send their kids to. So I was of the belief that once we start, people will come back. And there were very few people who had actually flooded the social media with a lot of information, as if the whole country is awash with that information. So I think it's been proven wrong. But see, looking at the domino effect, if we have in the house and 8 people are vaccinated, I think the 2 of you will think twice and say, what are we doing here? So I believe that with time, all that hesitancy will be removed, and we will continue providing education and providing information. And if you have any reaction, you have what you call adverse events from immunization, you will need to sort of fill a form, report to the nearest chemical, pharmacy shop, the hospital, and report. And we keep track of all this and see how we can also provide better information for people, respond better, and things like that. Yes.
I will ask you shortly about the next batch of vaccines that the president hinted must have arrived already, and how you intend to now roll out for the general populace. But there are people who have expressed concerns that those who were targeted, there are some who have sought to take advantage when they are not qualified.
Well, thank you very much. I've seen and I've also heard about that. The segmentation was largely to focus on what we say vulnerable people, people who are at higher risk of getting the virus, and those who might not do very well when they get it, and also keeping the system running. And so we had the state apparatus like the judiciary, executive, etc., and the parliament. One, we had the media, because an important state that we need to cover to ensure that we don't bring here. A few from the banks need to be electricity. So have essential service that runs around. And so you may see somebody who may look 25 or 26, but he's probably working at the control room at the airport. And so such people, we cannot afford to take them out. We cannot have the whole of the civil aviation control tower closed. And so they are all part of the group. And that may be, unfortunately, during the allocation, you may get a few misclassifications. If you have a media person who is hypertensive and over 60, where do you place them? Maybe in media, maybe put in the general public, maybe, and so you tend to have that. But as you can see, the top 3 are by the adults 60 and above. We also have the second, the highest, the health workers, which was a key priority area. And then the third, you have those with underlying condition, and then the others follow. And so when you have the general public, there's a lot of misclassification as to where they really belong. And so we are looking into the form to see whether we can further reclassify them. You see the security, etc., all gone. The media, we're supposed to get about 800, they are getting about 2,000 something. And I can tell you that a lot of the media people, when we said media, we didn't say media people who have a comorbidity. But you can have a media person who has a comorbidity, who qualifies in another group, and someone may classify them as media. And that's what's creating that thing. But by and large, the main class of the people, like the adults over 60, which is the top priority, are the people who have actually benefited in health workers.
All right.
The next stage, I'm sure you asked about that. From next week, we are starting the vaccination of all health workers across the country. Not just in Accra, Kumasi, and Central, but all health workers. And then we are going to start from next week. We collected all their data, in all the regions will be giving vaccines by next week to start vaccinating our health workers. And then that will be before we move into the stage 2 where we get to other people, so that the health workers will also be confident, because they are actually they are the ones who are more frontal with anybody who is going to hospital. So we need to protect them.
All right. Now, Kwame, we had this information about, a couple of countries that began to suspend the use of the AstraZeneca vaccine. And that immediately got people, I'll say, especially those that were having arguments with, who still had problems with it, trying to push it in our faces and suggesting that we may have been too much in a hurry to go take it, and so we should start worrying. Thankfully, you made such a quick intervention and gave us a publication with the statistics from all over the world that sought to calm nerves. Can you take us through that again, so that those who may not have had benefit of your article can allay their fears that there's no issue taking the AstraZeneca vaccine?
Thank you, Samson, and good morning to all listeners. Yes, I can. You see, you need to understand the background to vaccine development to understand what's going on. There's a lot of geopolitical gerrymandering going on in the European Union regarding vaccination. So, for example, if you look, the UK has got to about 36-37% of the population vaccinated, and mortality has dropped significantly by over 40-50%. Reinfections is down. Hospitalization is down by about 80-something%. So basically, the question has been about the AstraZeneca vaccine. It started with allegations that there wasn't enough data to back the use of the vaccine in over 65 years. But then, 2-3 weeks ago, the UK, Public Health England, and Public Health Scotland, as well as Clinique in Israel, released data for use of almost 9.3 million people who were over the age of 70. So that immediately put that misconception to bed straight away. And when it put it to bed, something happened in Europe. In fact, it was interesting because I was coming on a program with, I think it was PM Express. And I just left that press conference from Public Health England. So I had the data in front of me. And I did say on the program that I knew something was going to happen in Europe. While we were on the program, Germany backtracked on giving it to over 65s. Within 30 minutes, Spain had backtracked, Italy had backtracked, and then they made a demand on AstraZeneca to supply all their vaccines that a month ago they had said they didn't need. AstraZeneca then pushed back and said, you know how biological products are made. You cannot just come to us and say we should turn the taps on and give you vaccines. So we can't. Then they started invoking the withdrawal agreement conventions, trying to put the UK under pressure. And Boris Johnson said, I'm not interested. I'm not going to get involved. So then they went to Serum Institute of India, trying to get Serum Institute to give them stock. So Serum Institute then issued a statement saying, we can't supply European Union, but it's not going to affect the COVAX or any of the other supplies we have to give. But when they issued that statement, Serum Institute realized that no, they couldn't, because already they've committed to 50% of all their doses going to India. You must factor in that India is about 1.3 billion people. And India, because they are getting the production, thanks to the bilateral agreement between Oxford and Serum Institute, are saying that some supplies have to come to our country first, because we also have to hit herd immunity. Then suddenly, there was an incident in Denmark when on Wednesday, someone had the vaccine and then had a blood clot and had a pulmonary embolism and unfortunately passed away. There was no causal relationship between the two events. But you have to understand that these vaccines are under the emergency use authorization protocols, which then put them under what we call the Black Triangle reporting scheme, which then means that every side effect, like Dr. Abuaji said, has to be reported, even irrespective of how minimal it is. Once someone makes a report, it has to be logged, because that is how you get the data. But when there's a severe adverse effect, like a hospitalization or pulmonary embolism, then the regulators in that country have to do what we call a benefit risk assessment and make a decision as to whether they want to continue or they want to pause. Because of the geopolitical gerrymandering going on, regulators in the European Union are very sensitive to anything around the AstraZeneca vaccine. So when it happened, Denmark paused because it happened in Denmark. So they issued a 2-week pause because that is the standard amount of time it takes for regulators to investigate this. When they issued a 2-week pause, Italy then issued a pause. Then Austria issued a pause. Then suddenly, the press globally, without understanding what goes on in the movement of drugs in international commerce when it comes to biological agents, picked on it and started reporting that there had been a death. Immediately, the European Regulatory Authority issued a statement saying that there was no causal relationship established. Then the Medicines and Health Product Regulatory Authority also issued a statement. So what I did was, I then went on to the AAFI portal, the global portal, to see what were the side effect reports. I realized that the current side effects reporting in fact, I'm looking on the portal as I speak now, there have been over 420 million first doses of vaccines given across the world. 420 million. Out of that, 109 million is from AstraZeneca because it's the cheapest. It is the most easy to move around because of its storage requirement. Plus, Serum Institute is the biggest producer of biological agents globally, and they are supplying a lot of countries. So look at it, 109 million. So far, severe adverse effects for the AstraZeneca vaccine is 0.00027%. So 2 times 10 to the power -6%. Of these, the most serious side effect I've seen is, what do you call it, blood clotting, irregularities in blood clotting. And bear in mind that this adverse effect has been reported by all the vaccine developers, including Novavax, which has now just released this results on Thursday. It is a side effect they've all reported in very few patients. They link it to one of two things. Once you inject the muscle, you are going to cause clotting irregularities because you breached a tissue. For some people who have this irregularity, in very few people, you can trigger what's called a thrombolytic event. But it's in very, very small percentage of people. And there has been no causal relationship that it is the vaccine that is triggering it. It's rather the procedure of breaching the tissue that is triggering it. So that is a distinction we have to make.
Okay.
It is not a biological product. It is the process that we're going through to elicit and release the biological product that is doing it.
All right. So now that
when I looked at it and I saw all the noise going on, and I was getting tagged left, right, and center, I said, I'm not going to have the time to respond to all those tags. I am just going to write one article explaining everything in 10 steps,
right,
so that it can kill the mischief. And that was why I did what I did.
And the World Health Organization has been very helpful in also issuing a statement, being very categorical in joining the statement by the EU that there is no linkage whatsoever as to the blood clots and the use of AstraZeneca, and therefore the countries that are using should go ahead and continue to use them. So that should end it. And anybody who had any fears should be assured.
Yes, I mean, Samson, that should end it. But the reality is, like I said at the end of that post I wrote, if the thing was strictly about the science, this should be the end of the story.
Okay.
The truth is that when it comes to anti-vaxxers, it's not about the science, but the pseudoscience. And in the pseudoscience, communication matters more than the science itself. So they wouldn't differentiate between they wouldn't differentiate between the fact that the blood clotting has no relationship, why it's causing it, and the fact that it should end it. they would still feed on it. So we still need to be communicating constantly to our people to understand, because these are areas with very, very technical nuances.
Okay.
And if people do not understand and they read half-truths, the chances of them believing it is much easier. So much as I would have wished that would have ended, the reality is it wouldn't, and we'll still have to battle these things on the streets. All right.
Now, Dr. Kuwawaji, there's a message and a question. Kweku Nchubuesiakon says that he visited 3 vaccination centers and he was told that they had run out of the doses. One of the centers was the Ghana Health Service headquarters itself. When will there be availability of vaccines?
Well, thank you. I don't think it's about vaccines. It's about removing certain outreach points. We started with a surge and trying to look at a lot of points across the normal area. After a week, we withdrew them back to the regular health centers where they were. So places like the headquarters, the EPI, was all to mop up some of the staff around Kolebu to reduce all the movements around. But those ones have been after the initial phase, so they are not. So if you go to the nearest health center near you, where vaccination is regularly being given, you'll be given. So we've not run out of vaccines, as I told you. We still have vaccines, and we still even have some to give to the additional health workers that we're going to start from next week. Okay,
so the question I had asked you earlier, can you respond to that now? The next batch, when is it in? But the president actually suggested it's already, some already in.
Yes, we have some in already. We are expecting about, the total dose that is going to come from the COVAX facility, about 12 million shots, I would say, which is about 6.4 million doses. That's the number of about 20% of those we need to get to. We know that from March, early April, we are expecting 2 million doses, which will come between now and May. But we are hoping that by end March, etc., it will start coming in and will continue. The government is also pursuing other bilateral arrangements beyond COVAX to bring in, but a lot of it have come in and we are expecting some more. So the objective is to continue vaccinating until October. And so you don't have a stop.
What's the quantum of what has come in addition to the first batch, and what are the types? Same AstraZeneca?
Well, so far what we have is more of the AstraZeneca. We are working with Sputnik to get some Sputnik into the country. We have a lot of it in. We are expecting more in a week or so. And so by the time we run this thing phase out, the next phase will have been. So the objective is to ensure that we're having an inflow that we can continue slowly in vaccinating until, as the president said, by June, if we can do the 20 million, and if by October we have vaccine for children under 18 and pregnant women, they will head for the 30 million that we got. But of course, there are challenges, as Kwame said, with global shortage of vaccination. So that's why we are using multiple approaches in ensuring that we are able to bring in vaccines to cover as many people as possible.
Right. So maybe your very final words, what would you say to everybody as people get ready? There are some who are anxious, they can't wait for their turn.
Well, I mean, we just want to assure them that we are having the 4 groupings that have set up to do. We are in the first group, and everybody's turn will come. And I know that there's a lot of effort trying to bring in, led by the President and the Minister of Health, to bring in vaccines to vaccinate everybody within the time frame that has been set. So everybody must keep calm. But in the same meantime, let's still keep the protocols. I'm sure, like you are doing, you have your first shot, but still wearing your mask. We want everything to continue until the world says, I think now we can take it off.
All right.
Thank you very much.
Yeah, very finally, we heard that some people were reporting that the cards had run out, the vaccination cards. Is that sorted out?
I think it may just be an operational issue that some group may have picked less than they should have carried in addition to, but we have made more cards than the vaccines available. Okay. So if it happens, it's only a matter of time to replace. I think there are a few centers where they may have picked less than what they should have carried, or they got more people than they anticipated, and so we haven't run out of cards, and we are printing actually more. Right. And you're going to make sure that's secure, so that especially when you get your second dose, there will be a hologram that will show that you're fully vaccinated.
Right. But it's interesting, the data you're collecting in this process, do you have any plan how to use that data?
Well,
yes. As part of our national database, we are currently piloting an application that will allow us to do scheduling, appointments, and scheduling for our next visit. And we are hoping that by the end of the week, that will be ready. We can go back and enter data that was already taken. We are going to try that with the health workers. And I'm sure by that we'll be able to look at it. So the data is there, is part of mixed to our, is linked to our, is using the e-tracker, linked to our DMIS. And that's why it takes a long time to complete. We would have done more vaccination than we do, but we are taking a lot of information. But we expect that globally, very soon there'll be some data require your batch number to certify that you are really vaccinated. So we are taking all that step to ensure that. But we'll move into that. That will also generate some COVID passport for you, so that we can have some good data to back up and also share globally, so that if Kwame, I'm sure when Kwame is coming and gets immigration and the Port Health hits their database, they will know whether Kwame is vaccinated or not. They didn't find which batch he took.
No, I'm vaccinated. Yeah, but that's true. Yeah, that's true. That's very important. Yeah, that's very, very important, because that's where the world is going to go to.
Kwame, for those who are taking the jab and vomiting, I've had one or two of that, and I have a colleague who had that experience. What is that?
You see, Samson, thanks. I am glad that this has come up, because there's a lot of disinformation and misinformation going on as to side effects. So I'd want to take my time and explain. We need to look at what is happening with these vaccinations. The first thing is that ideally for most vaccinations in adults, they would want to do a pre-test to see whether the person has existing antibodies before they vaccinate. Because if you have antibodies, then the question is, should you have a booster dose or should you not be vaccinated at all? But this is a global pandemic, so health systems cannot just do that. It is not a cost-effective or a smart approach to open up the global economy. So what's happening is that they're saying that if you know that you've had COVID or you've tested positive, you can leave it up to about 12 weeks before you have your first shot of vaccine. The reason is simple. Once you've had the infection, you have pre-exposed antibodies. The length of the antibodies, how long they last, and your immunity training is still uncertain. We don't know. But because you have those antibodies in you, if you then had the vaccine, your immune system would recognize the vaccine as a foreigner. Whereas the vaccine ideally should go in to help your immune system train so that it can get antibodies and identify. This time it will identify the vaccine as the foreigner. So your immune system would give out a response, an immune response, which could include anything like nausea, vomiting, feverishness, headache, slight rise in temperature. It is a good thing. That is even the first indication of telling you that that immune system works. Your army can identify your enemy and attack them. But what it means is that you would have some discomfort. However, if you get the vaccine for the first time, you would not have that much discomfort, because if you've not had COVID before, then this is your first exposure, so your immune system is training. So you might even, the things you would feel might be so insignificant that you'd not even realize, apart from the pain at the site of infection and maybe a slight temperature. So because in Ghana, we don't know ideally what our seroprevalence is, there are some who go and take the vaccine who may have been exposed, they might have been mildly symptomatic, they didn't test, and they might have a more enhanced adverse effect, what we call an untoward effect.
All right.
Those ones should not panic, because the truth of the matter is they are even at the advantage, albeit ideally if they tested it would be better. And I'll explain the advantage. Everyone is having 2 shots. The first shot to train you and your immune system, and then the booster, which normally will give you this sort of reaction. Technically, they are having a booster and an augmentation. So their immune extended immunity is much longer than the general population. Unfortunately, they would have this short-term discomfort. I would have wished I was in that category, to be honest, because I would trust myself to be safer. But unfortunately, I took other routes by being a guinea pig and other things, so just another story. But I would have wished, and if you speak to anyone who works in public health, if it hadn't been for the case mortality rate that is high and the risk of overrunning health systems, most countries would have gone through that wild exposure to herd immunity. But the reality was trying that was going to lead to a lot of mortality, and that was why it wasn't tried. But that is one of the routes that, had it been the common cold or something, people would have, in fact, it was discussed. It was part of the UK, for example's rollout policy, and they then left it based on the mortalities that were coming. So all these things are things that have to be talked through and must explain why all these people are getting all these adverse effects and the nausea and the temperature and all that. It is not because the vaccine is bad or is going to kill them. It's more because their immune system is responding adequately.
Okay. Thank you, gentlemen, so very much. Dr. Kumar Boaje, perhaps if you can repeat that website that you said people can report complications or side effects. What is it again?
I don't have it immediately here, but it's, I'm giving it to Kojo. Kojo will give it to you.
All right. Thank you so very much.
Okay.
Dr. Patrick Kumar Boaje is Director General, Ghana Health Service. And Dr. Kwame Sapong Siedu is pharmacist and fellow, Ghana Center for Democratic Development. Thank you all so very much. We will take a quick break, return to look at matters of the State of the Nation address and the budget statement. But before that, Kojo Opon has the onerous task of leading communication publicly, nationally, to assist people in this direction. Is there anything you would like to say, having listened to the two?
No, I think for me, it's commendation to, first of all, our colleagues at the Ghana Health Service. In spite of the odds, a year on, they have kept the ship steady. The task force and all the advisors, Dr. Samwaba, etc., and to you, our colleagues in the media, who've also helped us to deal with a bit of this misinformation and disinformation. I mean, it was interesting making notes from Sapon's submissions. And I think that so far all stakeholders have done a yeoman's job. What we need to do is to ensure that the delivery of the doses is on time, the appointment system begins to work so that people can easily get vaccinated without a rush and without any complication. And once we're able to do that, we'll be in a position to open up the entire Ghanaian economy to full throttle and get our country back on track.
Right. And I hear people who are sending comments, including professionals in the health service sector, suggesting that there will be the need to do a lot more of the sensitization, education, particularly when it is being open to everybody else.
We take that as feedback. Currently, our sensitization and communication effort, which we are doing together with the NCC, Information Services Department, and Ghana Education Service, because they have an elaborate structure across the country, is concentrated in the 43 districts where the current vaccination is ongoing. And our expectation is that as we open up to the rest of the country, we will ramp up a bit more, but we take it as feedback.
I know that the president, when he was delivering his State of the Nation, actually encouraged the MPs that they also have a responsibility. They should go back to their constituencies and encourage the constituents to participate because they have received theirs. They shouldn't enjoy the protection alone. We will take a break here. We'll be right back. You're welcome back. This is NewsFile, it's the most authoritative news analysis platform. And here on NewsFile, as always, we put Ghana first. So we are streaming the web address that you can contact if you have any complications and you feel that you have to make contact with the authorities. It is adr.fdaghana.gov.gh/patient. I'm sure if you did that, you get it. But the full thing is on your screens shortly so that you can take note of it accordingly. All right. It is adr.fdaghana.gov.gh/patient. When you do that, you should get the help you require. Thank you very much.